She's sometimes sad, she's sometimes happy. She's doing things to make her life less crappy. Trying a treatment that's new on the scene. Let's sit back and talk about ketamine.
Welcome to Ketamine Insights, a podcast about mental health made by patients and the people who love us, and designed for patients and the people who love us. Today, we're hearing from someone in that people who love us category, my partner, Demond. We hope you enjoy our conversation, and if you do, please share this episode with a friend. You can find us on Patreon, Substack, YouTube, and Instagram. Now here is my interview with Demond. Welcome. Today, we're going to hear from my partner, Demond Walker. Thank you so much, Demond, for joining us. So I'm going to ask my first questions are just going to be about supporting a depressed person, I guess, in general. And you and I, some of our first in-person well, I guess it's strange you haven't even said hello yet.
Hello.
Hi. Thank you for coming on the show.
Cool.
I appreciate it.
Hey, anything for you, Mama.
Thanks, babe. Okay. So some of our first, not just some of our first, but our very first in-person conversations were about disability and mental illness. And I'm wondering, I guess, can you just talk about how those first few conversations went?
Sure. It was, how do I say it? A pretty stark difference from first dates that I've been on in the past. Usually people are wearing their mask or their cover and saying, all the right things or whatever. And you just opened up like a floodgate. This is me. This is what's going on. This is my deal. Deal with it. What's up? You want a date? What's going on? And I was a bit it was refreshing from my point of view, because getting through the layers of, the individual that you first meet or whatever, when you're trying to figure out if dating is going to work in that situation. You never know, if you're talking to the representative of the real person, but you were real right out of the gate. And it was refreshing. I think that's the overarching sentiment around that for me, at least. It was just very refreshing.
Then when I talked about ketamine for the first time, did that seem more scary, or was that did it just seem like another drug, or did it sound like a club drug, or did you know what it was before we started? I can't remember the first time I brought it up.
So I'd heard of ketamine before. I only understood it as a party or a club drug, like you were just saying. However, I know that, different drugs have different therapeutic uses and stuff like that. So you didn't strike me as someone who was taking it recreationally. And so I just kind of listened from the perspective of this is a treatment for her depression. And I really didn't know what to think. So I didn't really jump to any type of conclusion, if that makes sense. I was just kind of listening. Hey, what's this? Oh, that? I don't know anything about that. Well, I guess what's that all about?
Right.
I really didn't have any perspective on it. So I just kind of had to sit and, sit and learn about what was going on.
You had beginner's mind, as they say. You were just learning.
Yeah.
So I guess, going back to more broadly about dating somebody with a serious mental illness or treatment resistant depression in particular, were there worries as we started out? Was it oh, this might blow up in my face? Because I think that's a common, concern that people with depression have, or maybe also the people who start dating them.
Well, to be honest, I really didn't have any experience with someone who has been diagnosed with depression. So I may have known people who were suffering from depression, but no one who was, getting any type of treatment. So again, I think it was the beginner's mind kind of situation again, where, I kind of didn't know what to think. Within that, the second date, we started talking a bit more deeply about the depression aspect of things. And I was mostly concerned about whether or not I could like live up to the challenge, so to speak. Like, can I handle this? Can I do this? And that's, I think, when I asked, like, what role could I play? Like, how can I help? Or, what is it that you need me to do in a scenario like this? Because I wasn't sure exactly like what comes along with that, and whether or not I'd be equipped to handle the situation. So it wasn't so much worry as curiosity in the beginning, like, oh, that's different, I don't know anything about this, is that something I can do? So I just asked, hey, what do you need from me? And when you told me, I was like, oh, okay, yeah, I can do, I think I can do that. Okay, that's it. Okay, all right. So it was just, it was just brand new for me. Basically, it was all brand new for me. So I really didn't go into it with any like preconceived anything or, any stigma. It was just, because I was completely unfamiliar, it was just, again, more curiosity than anything else.
I remember when you asked me that, and I remember it hit me really hard, actually, when you were like, can I, like, how can I help kind of thing? Yeah. I was like, oh shit. No, I don't know. No, that's such a rare question, honestly. Especially from someone that you kind of just met, or I think, we were on our second date. It made me feel like we could be on the same side of it. Like you weren't scared and treating me like I was some kind of crazy alien.
Yeah. From my perspective, again, just not having any experience, there wasn't, I felt like that was really the only direction I could go as far as like my response to that is there something I can do, or what role do I play, or how do I, what do you need from me in a situation like that? And then, it would be up to me to determine whether or not that's something I could live up to, or, if it was manageable for me. So, that's really that's the first thing that popped in my head. Like, okay, she's got this, she's got that. Okay. What do I do? You know what I'm saying? What does she need me to do? Do I have to do certain stuff? Tell me what give me the playbook, and, I'll read through it. And if there's something in there that I can't do, I'll let you know now. If it feels like I can, handle it, I'll let you know now. And it was, the way you responded, put me at ease as far as like what the future could look like if we had, if we were to have started dating. And so, I was encouraged by, your response, and, it just made me feel a bit more confident about like how to go about it, or whether or not this could be a successful relationship in any capacity.
I remember feeling I was like, oh, instructions. Okay. I guess I could provide some instructions. Like it became very kind of concrete pretty quickly. Not like, okay, say this and do this, but rather like, I think what was it? It was like a Childish Gambino line, I think, that I told you, what was it?
I don't.
Between us, I think I remember. Between us, I think there's something special. I think I left that part out, but that's the line that comes before. The line I said was, if I lose my mental, just hold my hand, even if you don't understand.
Yeah, that's it. That's the one.
And that it just felt very good. I remember at the time to be asked that you were curious more than, scared, I guess, which was my worry. So moving along, like now from your perspective now, are there things that have surprised you about helping me, I guess, like helping me through all this stuff that we've been through over the years?
I think if I look back from where we are today, initially I probably assumed it would be a lot harder. I guess it turned out to be a little bit easier than I thought it was going to be, which is great. But I really didn't know what to expect, right? So it was just a scenario where I'm walking into the situation pun intended, blind,
Yeah.
and and just seeing what happens. So, but yeah, kind of in retrospect, I think it was just, it's just been a smoother situation than I would have expected. I think the reason why I had different expectations is because you always fear the unknown,
Sure.
right? So once things started kind of playing out, it's like, oh, okay, that's just that. Okay, this is just this. Oh, okay, I handle both of those okay. Well, the next thing comes up and I'm handling it okay. It's like, okay, well, this might be okay. I think I can, yeah, this seems okay. Hopefully, I don't know if it'll get worse or better or what, but so far so good, and I was kind of just taking it one day at a time, I wasn't, I didn't have any preconceived notions or an idea of how I wanted a relationship to look or what I wanted from a relationship at that point in time. I was just kind of like taking it day by day and seeing what came up and, taking the things that come at me, on a daily basis. So
you didn't have like a checklist of like, and then we'll get married, we'll have a white picket fence and we'll do all this stuff. Yeah.
No, I did not have any of those things. I was just happy to get date number 2. So, that's where I was with it.
Along the way, is there anyone that you've looked to for advice or as a role model? Like, or is there anybody who seems like they know what they're doing in this? Because I feel like everybody I talk to about it, and myself included, doesn't really know what they're doing. So I'm just wondering if you had anybody that you looked to.
Yeah, you.
Aww,
you are the person that, I'll be taking care of. You've been dealing with this illness for, as long as you've been dealing with it, and you better than anyone else and potentially know what you need better than anyone else. So I was basically just kind of taking your lead in the situation. To see, it's, again, I didn't have any predisposed notions about what the relationship could, should, or would be, or any type of checklist or anything like that. So it's just basically kind of observing what's going on within the context of the relationship, and then, trying to make the right choices based on what's happening. But definitely you were my guide in this whole situation. You taught me how to take care of somebody who, had treatment resistant depression. So I learned everything I know from you.
I'll say, like, from my side, it is very refreshing for somebody to do that. And also for someone to give you the benefit of, or not the benefit of the doubt, but like to let you take the lead, to give you the trust that you know what you're doing, I guess, or you're the authority on the topic.
Well, I definitely didn't know what I was doing, so I was hoping one of us knew what was going on. And you're a smarty pants, so it definitely helped that you're smarter than me for me to like take your lead in the situation. So I didn't mind. I was like, well, hell, she's smart as hell. So whatever she says is probably the right thing.
I feel like I guess one thing I'll say to the listeners is like, it is work to figure out what instructions to give. And it's very hard to ask, to like think that the person cares enough to do the thing that you need. And that can be a lot of us, I think, who struggle with depression, like find it very difficult to ask for help or to be clear about what help could be helpful, and to actually go through to actually ask, And so that was something that I worked on specifically with Demond. And I was very lucky that you were able to, that you were responsive to that, because then it was encouraging. Then it was easier the next time to ask for help, and easier the next time after that.
If you give a thing, just give me a thing, I'll for sure do that thing. You know what I mean? A list of things, cool. I will do the list of things. And then I know I'm good because I got a list. I've got your way to confirm and verify. Okay, did I do the first thing? Yes. The second, third, blah, blah, blah. So for me, taking that approach is kind of naturally the direction I'm inclined to go in anyway, just based on, my personality or just, who I am. So I just, and I know a lot of other guys that are like that. It's like, hey, I don't know, but if you tell me, I'll do it.
Yeah.
I don't know how to make her stop crying, but whatever you want, whatever you need, blah, 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 blah. I'm thinking in the context of like holding a baby or whatever and not knowing how to like calm the baby down. It's like, hey, how do I make this thing stop?
What are the rules here? I remember one time I was really upset and crying, and I remember you saying like, oh, maybe next time when you have therapy, you can ask. And I was sure you were going to say like, ask your therapist what to do when you start crying like this. And I was like ready to be a little annoyed because I was ready to be like, you think I haven't asked my therapist, But that wasn't the question that you told me to ask at all. The question you told me to ask my therapist was, what can you do when I get upset? Mm-hmm. And I was like, it never occurred to me to ask that. And so I did. And I think I remember what he said. I know it was 3 things. Yeah. I think one of them was just like, there were 3 things you were supposed to tell me, basically. One of them was like, I understand this is hard for you. I think the second one was just like, this will pass. Mm-hmm. And the third one was like, give me options. Yeah.
It's like 1 or 2 options, 2 or 3 options. It's a small number of options.
Of what to do next.
Right.
Yeah.
And then allow you to choose like what's best in this scenario.
I thought that was such a good advice too, because it was like, I'm still in charge, but I'm not responsible for coming up with the next thing to do.
Yeah.
And so if you just say like, do you want to go outside? Do you want some food? Or do you want to just lay in bed and we'll hang out or something like that? And I was like, okay, definitely food. Or okay, I definitely just need to lay. Like that was so helpful.
Yeah, I think so as well.
So I guess, okay, so talking now about ketamine again in particular, if there are family members out there who are nervous about their loved one trying ketamine to treat depression, do you have advice for them? Or like, they've heard it's a club drug. They've heard maybe that it's been used as a horse tranquilizer. Poor chemical, used one time as a horse tranquilizer, and that's its reputation for the rest of its life.
That's how I knew it.
Yeah. Do you have any advice for like family members or friends who are nervous about their
loved one?
Yeah.
I would just say, if anything, if we're talking infusion, it's in a, somewhat clinical setting, so to speak. There's a medical professional there. There's many cases of therapists there. Like that individual's going to be in good hands. So kind of wipe away the club drug, all the other, kind of stigmas that might be surrounding that, surrounding ketamine, and think about it from the standpoint of a medical procedure or a treatment. You know what I mean? I think that's the first thing. It's just understand that it's a treatment, that it's not for funsies, so to speak. Right. And once I think that's really the biggest hurdle to get over, because I had to get over that hurdle, even though I knew that this was like a prescribed treatment and, you were under the care of a doctor and therapist and all of these things. It's still, how I originally knew ketamine, or what I knew of it prior to meeting you and knowing about this type of treatment. You have to contend with your predisposed notion.
Sure.
At least I did. And, I would say if there's any advice that I could give around it, it's just, try to have an open mind, new treatments and different types of therapy are emerging on a regular basis for all types of things. And just because it's different doesn't mean it's bad, I guess, on a basic level.
What is it like to be around someone like when they come home from an infusion or have had a big lozenge, for example?
Fantastic. I like to laugh. I love humor and smiling and feeling, just uplifted by laughter and comedy. And if you have reservations about your loved one taking ketamine, just, try to approach the situation from a good mood. You're already in a good mood, and then let ketamine person walk in the door and you're going to be in a much better mood. They're going to have insights. They're going to have epiphanies. They're going to have lots of different things to say. And I think if you embrace it, if you lean in to the infused individual, so to speak, if you just lean into what's happening, you'll really enjoy having someone around who's filled with ketamine. Because in Molly's case, and I'm assuming this will happen with most people, she has things that she's going to want to talk and she's going to have things to say, and you just have to let it flow. Just let her get it out, and it'll be fine. It's some of the stuff you're not going to understand. Some of the stuff is going to sound like, a wise guru from a mountaintop is speaking to you and handing you the stone tablets. But don't be so quick to react. I would say, if I had any advice, and just let them drive, so to speak. You might end up getting tacos. You might end up on a walk around the beach. Who knows what could happen? But for me, it's just generally been a pleasant experience. You haven't been sick, nauseated, and things of that nature in general, like post-ketamine infusion or a big lozenge. So it's really just been kind of hanging out with someone who, I don't know, is kind of, at least in your case, for me, it's like hanging out with someone who has a bit more of a carefree attitude. You just seem more carefree post lozenge for a few hours, and you're just a lot of fun to be around. It's cool. You want to visit with nature, you want to listen to birds, you want to do all types of stuff. You're noticing blades of grass, you're doing everything. And so I kind of live vicariously through you in those moments. Like, man, it must be nice. It must be nice to just sit and have an opinion about the formation of the clouds. I never think about stuff like that. But then again, I don't do ketamine, so that might explain it.
It is true. I think there's this, I remember, I think once telling you, don't yuck my yum kind of thing. Don't be like, damn, you're high right now.
Yeah.
Because in part, I wanted to say that because I felt like there's something about after ketamine, there are some parts of it where I feel like I'm more myself. I'm high and I'll maybe saying things that I wouldn't otherwise say, but in a way it's like I feel most capable then. And if you tell me if you kind of make fun of me for saying high shit, then I feel like it just kind of pulls you out, it kills the mood or whatever.
Yeah, I think that's something important that you told me very early on.
Yeah.
Post-ketamine and pre-ketamine, going into the infusion, you need for the environment to be, or your mindset to be a certain way. And so outside individuals kind of, having some negativity or whatever the case may be could influence the infusion. And then post-ketamine, the same thing. I think you said something like the 72 hours post infusion are very important. And this idea of not yucking your yum, so to speak, becomes very important during that period of time, where I try personally to present an environment that's just pleasant, that's, embracing of what's happening, that is kind of, supportive and uplifting, and just, just a good environment for you to come back to kind of earth, so to speak, with. And, whatever's happening, whatever the ketamine's doing, whatever, however it's interacting with your brain, just allowing it to kind of freely do what it needs to do without the obstruction of judgment or teasing or any other thing that could make that person self-conscious or insecure about what they're doing in the moment. Because for sure, a person that's on like a high dose of ketamine is going to do something that is not ordinary for them. So just trying to keep your poker face and, not laugh or not, you know what I mean? Like make that person feel like they're being ridiculous or whatever the case may be. In my experience, is very important to like allowing the ketamine to do its thing. So if I had advice to give, I'd say definitely try to refrain from negative comments, the news, all the stuff that's going on. Like all of that type of stuff is not time for that. Take a break from life. If you're the individual that's with someone that's, kind of coming out of a ketamine trip, pretend like you're 15, 16 years old again. Just relax, have fun. Don't take anything over the next few hours very seriously. And just hang out with that person and just don't take it too seriously.
Use it as a mini vacation.
Kind of. Yeah, kind of. Just take a break from all the serious aspects of life and hang out with your buddy that's, post infusion. So
I love it. I think that's great advice. I think I've had a lot of different people pick me up and like from the infusion clinic and stuff. And honestly, some people are a little more relaxed than others in that situation. But overall with ketamine, how do you think it affects my mood and well-being? Like not just right after the infusion, but do you have an opinion about like whether or not it's been a helpful tool for me?
I'm not a doctor.
Me either.
I'm not a scientist. Honestly, I'm kind of just taking your lead in the situation. You say that it is or isn't working, or it worked this time, it didn't work. Whatever you say, I kind of roll with it. I don't spend a lot of time trying to judge what's happening. I'm just here to support, so to speak. I feel like that's the best role I can have in a situation. So I don't really know. I mean, I can definitely like recall post ketamine, like the state that you're in post ketamine. But beyond that, I would say if there's something that is consistent related to ketamine, is that week of, past the ketamine infusion, the week of, or the week after, I should say, you seem to be generally in a better mood than you would traditionally be in. Like it often happens that for a period of time after the ketamine infusion, your mood does seem to like lift up for whatever period of time it lasts. So I can definitely say that. I think that it's helpful for you to have something that you feel can reliably affect your mood. And so I think that confidence in the treatment kind of seems to have a positive effect on your disposition toward your depression in general. It doesn't seem like you're so down on the fact that you have treatment resistant depression because the ketamine exists and it does what it does, and it's hard for me to think about what things would be like if there wasn't a ketamine treatment available.
Yeah. Right. And I guess it's a hard question anyway, because you didn't know me before I was trying ketamine. And
right.
So, yeah. So last couple questions. Is there something that you wish, just in general in the world, that people understood about mental illness that they generally don't understand, or stigmas or whatever, that misconceptions people have about people with mental illness?
I really should have taken ketamine before answering these questions. I feel like I don't
have that big scope.
I don't have like the ketamine insight type of mindset that I need to answer these huge questions. Stigmas, Ask me the question again.
So I guess I could put it differently.
Okay.
Is there like a guiding principle or anything that you stick to when things get hard, or when between us, when I'm like really not doing well? Is there some piece of advice or some, like, I don't know, some truth that you fall back on to help you know what to do, or to help you stay patient, or that kind of thing? Is there something that you've learned, or anything that helps you kind of maintain the course? Because I know it's not always easy.
I'm not a doctor. I'm not a therapist. I'm not a scientist. I don't know what I'm doing. So if I stay grounded in that fact, then I can kind of approach it from a gentle standpoint. Like, I don't know what I'm doing. I don't necessarily know if what I'm going to do is the right thing. So kind of like my demeanor, or just my attitude toward it, is one of humility. And I think if people approach scenarios or individuals that they deal with humility, like, because we all think we know everything, right? We got the internet, it's all types of search engines, some better than others, and we read a few articles, we got some holistic health articles, and we think that tea tree oil and burn some incense, and did you try going to sleep earlier, maybe you should try no meat, or whatever. Like, it's everybody out there has a bunch of opinions about all types of stuff, but for the most part, we don't know what the hell we're talking about. We don't know what we're doing. So I think the best thing to do in a situation like this is, you're dealing with someone's mood, and there's certain, like, from my perspective, at least, I would imagine there'd be certain insecurities and things that go along with having any type of illness, but mental illness especially. I just think that people would benefit from just having a bit more humility when approaching individuals, and just approach from a perspective of like care, concern, and and trying to understand, and not because. And I guess I'll elaborate a little bit, because people who want to give you advice do care, and they are concerned about you, but they also think they have the answer. You don't have the answer. You don't know what the hell you're talking about. Stop trying to like fix it, and just be there for the individual. You know what I mean? I think that's the best advice I could give around that.
That's great. I think that's great. It's perfect. And it's, I remember one time, I can't remember why this came up, but you said, I don't know, I just approach it from like, it's 100% not her fault. And I think I just burst into tears when you said that, because it felt so good to not be blamed for the thing, that's making me suffer to begin with. I remember you saying something like, you wouldn't be like that, you wouldn't be suffering if you could help it. You wouldn't do this if you could help it. And it felt like a breath of fresh air, because I was like, I wish everybody understood that. I
think that's a very good point. I'm glad you pointed that out. I do remember saying that. And I think, to further tie it to what I was saying, if you approach the situation from that standpoint, like, I think when people try to give advice, they're not approaching it from that point of view. When you give an advice to someone, you're basically saying, you didn't do this, you should do this. Like, if you had just done this, maybe things would be different. That's kind of how it would resonate, to the person that's receiving that advice. And it's just not, it's just not true. That's just not how depression works. The people who are depressed, if they could not be depressed, they wouldn't be depressed. They're not doing it on purpose. They're not depressed because they didn't do a thing, or they should be running in the morning, or whatever it is, that's just not how it works. And I guess, from approaching it with more humility and less, I'm trying to fix it or I want to give advice, is beneficial to the individual that's, that you care about. Like if you want to express how much you care about that person, ask them what they need, as opposed to trying to dish out random advice that you Googled or whatever.
Yeah, or didn't Google.
Some meme, some, whatever, some checklist you saw on Facebook or Instagram or TikTok or something like that. Like, relax. And just, just approach things with a bit more humility, because the advice, as much as you might be coming from a good place or a place of concern or care, you might love that person. You really have to be considerate around how that is going to be received. And generally, when you're giving advice, it kind of comes across as you should have done X or you should have done Y, which is kind of accusatory in nature. And it's just not how illness works, It's just not true. So yeah, I agree. That's very important. I think that's probably one of the most important things.
Yeah, I think I couldn't agree more. You're right. It does feel like that. It feels like people are saying, well, if you had only done this differently. And it also feels like I've solved this problem in 30 seconds that you've been struggling with for years.
Right. And it's just not true. None of us are like, relax, like calm down. You're not this smart. I mean, you may be super smart, but you don't know what you're talking about. You're not a therapist. You're not anything that you need to be to fix this in a blink of an eye.
Right.
Like if it could be fixed in a blink of an eye, that person would have blinked a long time ago and made it, and fixed the situation. So yeah.
Well, that's it, babe. I don't have any other questions. I just want to thank you so much for being a wonderful support and coming on this show and telling people.
Cool. I don't know. This is, my first time being interviewed. So,
you did great. I think. I don't know. This is my first time interviewing. So
we'll see. Yeah.
Thanks for breaking the ice with me. And thanks for that kick-ass theme song.
Oh, we got to do that. Okay. That's all right. I'll see how you're going to do. No, that's cool. No, I'm not upset. No, what?
What? I didn't even say anything.
I'm fine. No. Yeah, I did the theme song. It was mostly supposed to be a joke. It turned into what it turned into. But, like you said, as far as support is concerned, once I realized that you wanted to do the podcast, you were serious about it, and you really, kind of were hoping that you could get some help in that area, then, of course, there was no way for me to, turn that down. To everybody who listened to it and thought anything of it, I don't know what's wrong with you. But, hey, thanks.
Thanks, Demont.
All right.
We hope you enjoyed this episode. If you did, please share it with someone who might find it helpful. You can support us by subscribing. Just search for Ketamine Insights on Patreon or Substack. This episode was hosted and produced by me, Molly Dunn. Our theme song is by Solid State Symphony. Remember to advocate for yourself and never ration your joy.
She's sometimes sad, she's sometimes happy. She's doing things to make her life less crappy. Trying a treatment that's new on the scene. Let's sit back